Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Vipak Kalpana and clinical aspect of Vipak. We have seen Trividha Vipak, how to confirm the Vipak Lakshana, especially of the new food products, and a vast area of research which can be done in Ayurveda on this Sankalpana, because there are so many food products which are newly added in our daily lifestyle. Now, when we are in practice, we always remember the drug by its virya or rasa. For example, Chitrak, Ballatak, Ushna Virya, Shatavari, Chandan, Shita Virya. There are so many drugs we use in practice and mention in the text, but the drugs which are really famous in clinical practice because of its vipak are very less. Generally, we choose the dravya for virya, for prabhav, or even for the ras, but as compared to these three factors, the drugs known for their vipak action are comparatively less. I am not claiming that vipak doesn't have any action or less action, but in practice the preference is given to these other factors. And my question to you, what will be the reason behind that? See, Shatavari is Madhuripak, Madhur Ras, Madhuripak, Shitavirya. So Madhuripak will assist this Madhura Rasa and Shitavirya action definitely. Katu Vipak will assist this Katu Rasa and other Ushnavirya etc. Similarly, Amla Vipak will also useful to Amla Rasa and will assist that action. But drugs chosen only specifically for Vipak action are very less. In text, they have given the examples of Madhu, that it is Madhura Guna, Madhur Kashaya, but because of Katu Vipak, it is useful in the Medorog or in the Kafaja Vyadhi. But in today's era, there is doubt about the sugar content of the honey, etc. Let us keep that subject aside. But in our practice, if you think, you will find that you have used the drug for specifically vipak action are very in less quantity or in the less numbers. So my question is, what may be the reason behind this? What is the example? Let us discuss this point today. What is the definition of vipak? It is the Jatreda Yoga Yat Uditi Rasandaram. It means there should be action of Jatrani first, and then that after product of Jatrani digestion, vipak is formed. This is the one concept we have seen in the last episode. When we learn Vyadhi Ghatak, there is a famous slok, we all know about it, Roga Sarvi Mandegno. It means Agnimandya is a major factor in n number of diseases. Now, if vipak is the product formed after the Jatrani action, and this is the one side, and other side, a patient, there is Roga Sarvi Mandegno, means Agnimandya is a major factor in n number of diseases, then if Agnimandya is there in many diseases, naturally formation of or chances of formation of good vipak or proper vipak also become less, as vipak is totally dependent on the Jatrani action. Hence, if you compare the other three factors, rasa, vipak, virya, prabhav, they have their independent action and they are not dependent on any other body conditions. On the other hand, vipak is totally dependent on Jatrani, and Roga Sarvi Mandirno is a slok where Jatrani is a major factor in many diseases. Automatically, this condition will affect the formation of vipak. Jatharni Mande is there, so naturally there is no proper vipak formation, and if there is no vipak formation in proper way, automatically its action on the body will not be seen properly. So, why we don't use many drugs which have vipak as a major contributing factor in the treatment? These are the limitations of vipak. Hence, na virya krute kinchit. Virya is the thing which all the body actions of the dravya are seen, and it has given important. Prabhav is achintya. It has given important, and rasa acts as soon as rasa nipa dravyanam, as soon as it comes in the contact with the body, either of the skin or jiva. All these three factors, they are totally independent in action, and they are not dependent on any other body condition. And on the contrary, vipak is dependent on the totally dependent on Jatharni proper avastha. And if it is hampered, Jatharni is hampered, it is Agni is there, vipak will not be formed. Hence, in our practice, vipak dependent dravya are very less. We depend on vipak, such dravya are very less. When Agni is proper, automatically health is more on the proper side. But still, if Agni is there in the proper way, vipak will be formed properly, and then only the action of the desired action of the vipak will be seen in the patients. So, this is the difference between vipak and other three rasa, virya, and prabhav. But again, it is not my claim that vipak does not have any action. The action we have seen in last episode are seen in the body, and only thing is factor is the Jatharni should be proper, and that's why we have got many limitations to see the action of the vipak of any dravya. So we conclude here today of the vipak kalpana. In next episode we will bring a new chapter. Meanwhile, there is Diwali in the next week. So very happy Diwali, happy, healthy and prosperous Diwali and New Year to all of you. We are taking break for this Diwali festival, and we will meet after 15 days. Thank you very much.